CLL cells are not growing in a test tube. They are growing within specific tissues, and these tissues are made up of an astonishingly high number of different normal cells, which are enslaved by the leukemic cells. Leukemic cells talk to these normal cells and utilize them. So what we have been doing over the past 20 years has been trying to dissect this microenvironment and see which are the most important cells. Most important, I mean, in the sense, the cells that help mostly CLL cells. And we, at the end of the day, we have analyzed all different cell populations, and we have come up with the fact that macrophages are the most important cells. And actually, we know that some of these, let's call them, even if it is not scientifically correct, helper macrophages, in the sense that they help the growth of leukemic cells. Some of them derive from circulating monocytes, which enter the lymphoid tissues and are mature there into macrophages, which then take physical contacts with the leukemic cells and help them proliferate and grow. It is not unlikely that there are also some resident populations of macrophages that we have not yet properly characterized that may do the same job. So what we have seen is that if we, and this has been seen in vivo but in the animal model, if we get rid of macrophages, we significantly, drastically reduce the leukemic growth into the mouse. Now, one intelligent way of getting rid of macrophages is to use a monoclonal antibody against a receptor which is on the surface of macrophages and is the key receptor for macrophages. Now, the important point is that this monoclonal antibody, which works both in a mouse and in vitro in man, but can also be utilized in humans. And actually, there are a number of trials in solid tumors with this antibody. So my prediction is that not too late, there will be trials also in CLL with the idea that getting rid of macrophages can block or hinder the progression of the leukemia. There's another interesting fact, and the fact is that when you get rid of macrophages, the leukemic cells within the tissues, they don't remember where they are, so they are pushed out of the tissues and enter the circulating blood, very similar to what happens in patients who are treated with ibrutinib. So in the mouse, we have combined the monoclonal anti-macrophages with a monoclonal anti-human CD20, and the results are really spectacular. So I think that this is what I'm going to say tomorrow, and I think that this approach may have, well, I'm usually optimistic, but I think that we can reasonably say that it can have a bright future for the patients.